Hi, have you ever wondered how healthcare works in other countries? Access to doctors, affordability, and quality of care can be very different depending on where you live. In this video, we'll speak with a guest from France about their healthcare system, focusing on access, equality, and the challenges related to our main topic, SDG 3 goal, good healthcare and well-being. And if you're not familiar with SDG goals, it is short for Sustainable Development Goals, also known as the Global Goals. It was adopted by the United Nations in 2015 as a universal call to action to end poverty, protect the planet, and to ensure that by 2030, all people enjoy peace and prosperity. Out of all 17 goals, SDG 3 is mainly about ensuring healthy lives and promoting well-being for all ages. On the picture, you can see the 5 goals SDG 3 mainly focuses on. 1. Reduce preventable death. 2. Control disease. 3. Promote healthy life. 4. Ensure universal health. 5. Strengthen health systems. Okay, now that you know more about SDG 3, let's get started with our interview. So, the first question is, what are your thoughts on your country's healthcare system?
I think it's definitely a great system, very egalitarian and universal and of public interest. What I mean is that in France, everyone has access to health insurance, and they can also pay for a private one. And this insurance, they helps to pay for doctor visits, hospital stays, and medicine in general. So most people, they pay a small part, and the insurance, they pay most of the cost. So, and people can just can pay for a private insurance that can also cover like additional costs if they have the necessary funds. So you can either have the general one, or you can pay for a private one if you need more assistance in paying all the medical costs.
Yes.
So adults, they pay the system depending on their work, because for instance, during my previous work, the company provided the insurance, the private insurance. So depending on your company, you can have different private ones, and people, they pay for the children insurances. So this way people can see doctors even if they don't have that much of money, I would say. So this is a system of distribution that benefits everyone. Even if you have very poor resources, you can have access to medical health care. So this is very the opposite of what we can find in the US, for instance.
Yeah, I heard of it. Yeah, both sounds very complete. Thank you very much. And the next question is, have you had any difficulties in your past medical experience?
I would say no for this question, because my father is a doctor. So that I wouldn't say that my situation is relevant, but so because I've had access to medical needs very, very easily. But I would say that many people around me, they really struggle to find appointments, especially in very specific medical areas like dermatology, when this is very niche and very specific.
Sounds similar to us, I think. And okay, so on to the next question. Do you think the system is fair to all social groups? But I think you kind of answered it just then.
Yeah.
It's good.
I've also prepared like a few elements for this question.
Thank you very
Because
much.
I would say that that the only downside, because the government, with the general health insurance, the government provide money, so it costs a lot for the I would say the national economy. So the government has also seen that and noticed that many people would abuse of the system. So there's been issues, but I would say that this is something that should remain in France and that should be accessible to the most.
Yeah, thank you very much. Okay, and question number 4. In your experience, are there any gaps between city and rural healthcare quality?
Yes, a lot actually in France. I come from the countryside, yeah, and I would say that there is a big lack of doctors, and sometimes you have to wait for months to have a regular appointment for a doctor, even like a generalist. In France, we have a term called medical desert, which means that this is an undeserved medical area or an area with a shortage of healthcare. This mainly applies to rural areas. So I've got the chance to live in Paris. So I grew up in the countryside, but I lived in Paris for many years. So I didn't have this problem because Paris is a big urban city. So I would say that there is a big inequality in terms of access in big city compared to rural areas. And also we have an application, a mobile application in France that is called Doctolib. And this application really blew up during COVID. And this is an application where you can find doctors around you and book appointments very easily. And this has been a very game changer to find local doctors near you, and also to check the availabilities and to also have access to a big portfolio of doctors, and not only the ones you know from mouth to mouth.
The gap is out of my expectation, but yeah, French is kind of big, so I can understand that.
I want to ask,
did you do any activities for SDGs 3 in high school?
No, I did not. And the only thing related to sustainable development goals I can remember of was in primary school, and where we visited a local recycling center, but nothing that looks like what you're doing now.
okay, I understand. And next question is,
What do you think is the most important challenge related to SDG 3 in your community?
So I would say for this question that the most important challenges would be to make sure that this system still exists, this system of redistribution and of access to general health provided by the government. Because the government, for instance, because I wrote down this example, the government really recently started a campaign to raise awareness about sick leave conditions, because the government noticed that repeated cases of abuse, once again abuses of the system, when people were asking their doctors for sick leave for reasons that the government considers like non-legitimate. So I would say that the main challenge would be to keep this system as accessible, because the government nowadays tries to really strengthen I would say the restriction to make it less accessible to the people in need because of budget issue mainly.
okay, thank you. And what health problem do you think is the most common in your country?
I would say here that the lack of means, money and resources for public health institutions, because in general we noticed as citizens that there's more and more government shortage and less public funds when it comes to public health, and this had an impact on the system in general, because this led to more and more privatization. So people tend to go to private health institution because there is a lack of people, the lack of doctors, because also a lack of nurses. So the treatment for patients is less and less, I would say, of good quality. So this led to more and more privatization. People just not going to public institutions but going to private ones. Also, I would say lack of recognition of people that are on the lower hierarchy of the health system, like nurses and nursing auxiliaries. Like they are not enough paid, for instance. So less and less people want to work in these fields. So this leads to less and less people in these institutions. So lack of people, lack of resources. Also, another challenge would be medical access in rural areas, as we talked about. And also, another one is increases in the case of psychological and psychiatrist issues. Because following the pandemic, especially young people, the government launched many campaigns related to, I would say, mental health issues, because this is something that is unfortunately growing in France, and especially for young people. And also, I've mentioned earlier that the universal health insurance and the fact that people they can also buy and register to private insurances. This system can be unfair because people with more money can have access to better institutions like private ones. So that would say that this can lead to more inequalities.
Yeah, I think a lot of countries have the same problem.
Yeah.
And next question is, what do you do to stay healthy in your daily life?
I would say simply eat well, sleep well. I am personally a vegetarian, so I do take care of what I'm eating, and also in general in other aspects of sustainable development goals, like reduce meat, reduce animal, increase animal welfare. So I would say that this is a key point of focus for me. Also being very active, I'm doing lots of sports like cardio, running, swimming, and also take care of my mental health, because I would say it's essential to feel both good in your head and in your body to be healthy.
Okay, thank you so much.
Yeah, that's all our questions, I think.
Okay.
Thank you very much for allowing to do this project. Thank you very much. Do you have any questions or doubts you want to ask or no?
No, my question is, were you surprised by my answers?
No, a lot, because I thought it would be fast, but yeah, you answered very deeply, and I kind of thought that's cool. Yeah.
Do you think that is the same for you? What I said?
Yeah, I mean, Taiwan has pretty free healthcare to everybody, so we have same problem, which is used by wrongly false use. So yeah, it's kind of the same problem, but not but Taiwan is small, so we don't have so much of city and rural problems.
I'm good, thank you.
Yeah, so I think this will be the end. Thank you very much. That will be it. Thank you very much. Bye bye. Have a great day. Thank you very
Bye bye.
much.
Bye. Thank you.
Thank you. That is the end of our interview. Now, let me make a brief summary about it. Question number 1. Thoughts on France's healthcare system. It is universal, publicly funded, and ensures that everyone has access to health insurance. There is also an option to purchase private insurance for additional coverage. All in all, the system allows people to receive medical care regardless of their financial situation. Question number 2. Difficulties in past medical experiences. Many people struggle to find appointments in specialized fields because of high demand and the shortage of specialists. Question number 3. Is the system fair to all social groups? The system is generally fair and should remain accessible to all, though it is costly for the government and sometimes abused, which has led to stricter control that may limit access for some individuals. Question number 4. Gaps between urban and rural healthcare quality. Rural areas in France suffer from severe doctor shortages, known as medical desert, resulting in long time waits. while large cities have much better access to healthcare. Recently, digital tools like Dr. Lip have helped improve appointment access. Question number 5. Participation in SDG-related activities in school. Our interviewee did not participate in SDG-focused activities in high school, but does have experience in activities related to sustainability topics during elementary school. Question number 6. Key SDG 3 challenges in the community. Budget pressure, abuse risk reducing, accessibility, and lack of resources and specialists are some of the issues that the current system may face. Question 7. Common health problems in France. Underfunding of public healthcare, staff shortages, increasing privatization, rural access issues, growing mental health concerns among young people, and widening inequalities between public and private healthcare access. These are the main common health problems mentioned in the interview. Question number 8. Personal health practices. Our interviewee maintains health through a balanced diet, regular exercise, sufficient sleep, a vegetarian lifestyle, and attention to mental well-being. They emphasize the importance of both physical and mental health. We hope this summary can help you understand our interview better. Through this great interview and project, I've learned so much more about SDG goals. Looking back on this interview, I think the most important thing is that even universal healthcare systems are not perfect. While France offers broad access to medical care, there are still gaps caused by location, funding, and availability of healthcare workers. Overall, this conversation helped us see that achieving good health and well-being is an ongoing process. It encourages us to think more critically about healthcare in our own communities and the role we play in supporting a fair and sustainable system. As we wrap up this video, today's interview gives us a better understanding of how healthcare works in different parts of the world. Hearing about France's system shows how universal healthcare can make medical care more affordable and accessible, while still facing concerning challenges. By learning from different countries' experiences, we can better reflect on our own healthcare system. We hope this video encourages you to think more about how healthcare affects everyday life and why access to care matters for all of us. Thank you for watching, thank you for listening, and have a great day.